All right, Kentucky, it is 5 o'clock on Easter Sunday. Happy Easter. In my faith, today is the day that we greet each other by saying the same phrase, He is risen. And people respond with, He is risen indeed. So happy Easter Sunday, happy Passover to those of the Jewish faith and to everybody out there. I hope that you have had a good day. Let us first start by saying what my faith tells me that I know is the truth, that we will get through this, right? We together. Well, I haven't gotten there. That we will get through this. We will get through this together. And Virginia, I think you inspired a couple others. Let's watch their version of this.
We will get through this together.
Thank you, Governor. We'll all get through this together.
We've talked about how when we come out of what is a very dark time that we hope that we can bring positives with us. And certainly Virginia's effort and her influence, I hope, has taught all of us the importance of including everyone. And every day that we do this, we're going to learn a little bit of sign language, which we're going to do here in just a second. Folks, we're going to get through this because we're going to follow the 10 rules that we talk about every day to making sure that we defeat this coronavirus. And today, because we want to go a little faster, I'm just going to talk about a couple. Number one, stay home. We have to be healthy at home. There are more ways to connect, to express our faith, to do everything from our home. Take advantage of them. This is your duty as a Kentuckian and as an American. This is how we protect our most vulnerable. This is how we don't spread this virus to another nursing home. This is how we reduce our number of deaths. This is how we don't overwhelm our healthcare capacity. Your decision to stay home, even when it's really hard to stay home, is what saves lives. Thank you, Kentuckians, 99.99% of Kentuckians, for doing your duty. We appreciate you. And people that you have never met are going to be alive 3 months from now because of your willingness to do it. Avoid crowds and gatherings. Again, no exceptions. Every crowd spreads the coronavirus right now. It's in every county. It's in every part of the Commonwealth. And it'll be in every building that any mass gathering is occurring, no matter what that building is. So let's make sure that we avoid those mass gatherings. Social distancing. This is not an excuse to try to get together. What this is if you are out grocery shopping, you need things to repair your home appliances so you can be healthy at home, or you're going for a run. You come across somebody 6 feet apart. Sure, say hi. Ask them how they're doing. It's really important on the mental health here. But it is not an excuse, social distancing, to get together. It's how we make sure when we come across each other in this coming month that we make sure that we ultimately are safe. I'm going to just switch one more, apply for benefits. I know that some are still frustrated on the unemployment side, but we are processing more than ever before, and we want to make sure that you have everything you need to get through this. Also, sign up for Medicaid. Going to be really important to our healthcare professionals and systems to have you on that. We always talk about the 10 rules plus one. Fill out your census. We are doing better than other southern states, but we are nowhere close to where we need to be. So make sure you get this done. So if you're of my faith and today is Easter, one of our lessons is caring for the less fortunate and trying to lift everybody up. Well, the federal dollars that flow to so many of those programs, to feeding the hungry, and to others depend on us filling out this census. So if you haven't done it, it's Easter today. take a minute to do it, knowing that you're helping out those that I think our faith compels us to. Let's not be number 18 in the country on the census. Let's be number 1. Let's take pride in that, and let's do it. So we always also ask that you take the amazing things that you are doing, following these directives, limiting your contacts, modeling the very best type of social distancing and behavior, connections virtually, the things that are going to get us through this together, make us strong as we come through it, and also protect people, and you've done a wonderful job. We've asked you to use these hashtags. Keep it up. I believe that over these next couple of weeks, it's not only one of the most important times, it's a time where some folks are going to want to lessen restrictions at a time when we need to be better than we've ever been. So keep putting these up. It helps people. It helps me. It's not easy times for me, but it's a lot harder times for many others who are out there. I love looking at these, so please keep it up. Let's look at what we have today. All right, this is some of the amazing Easter resurrection celebrations that have been going on today. This is the one for Bates. Somebody watching it, the pastor there, Bruce Williams, did one of our videos encouraging his entire congregation to stay home. We appreciate him. He actually sent me a text today, which I also really appreciated. Just trying to do the right things each and every day, and having faith leaders that are there with you, encouraging the right things is pretty special. All right, here is another one. This is one of our frontline healthcare workers. Remember, this person's heroic, going in every day to situations where the virus could spread to her. But she does it to protect people. Remember, we have to protect her and her family and her coworkers. And every time we go to a mass gathering or we don't stay healthy at home, what we do is make it more likely that she's going to get that virus. Based on our decision, she would get that virus. Now, let's not let that happen. Let's make sure that we are protecting those that are protecting people and helping people that need it the most. All right. This is, again, another service, and you can see part of it. What I love about this one is that it has so many different people involved, and even people who can see other people. One of the things that you like when you sit in church, and I know you're supposed to be just looking ahead the whole time, but you always look around a little bit. You want to see who's there. You want to smile at people that you know. Hopefully you don't want to notice who's not there that weekend. But yeah, it's just, that's part of our worship service. And I like this one. And I hadn't seen this. And the live stream for my church is just directly there, though you could see people's comments. I like this one because you could still look around in that virtual pew. And I thought this was pretty neat. Easter eggs honoring at the top the people that they should be honoring, those that are out on the front lines, our truck drivers who are driving supplies that are desperately needed, our nurses and our doctors. And I just thought that this bottom one was was a little bit funny too. And we appreciate people being creative and spending time, and it's time at home. And if the bottom part is that we feel together during these, I hope we can continue that. We've got tough times and we've got tough decisions, but we are one Commonwealth, united, protecting each other, and trying to do the right things each and every day. This is a great-granddaughter coming to see her great-grandmother. This virus can take anybody from us, and this virus can move through anybody. But as we look at our nursing homes, our senior care facilities, it is certainly where the most damage is happening right now. And remember, the way that it gets into a nursing home, the reason that we have social distancing to protect her is that somebody does something that they shouldn't, and that's passed to someone else, that's passed to someone else, that's passed to someone else, that then impacts somebody that we love. The people that ultimately pay for a bad decision aren't the people that make them. They're people who are completely innocent of it. So let's make sure that we're doing everything that we know by making the right decisions, that we can protect those around us. All right, this is a Google Meetup session that's being done healthy at home and through here, I believe it is high school. Ways that we are still connecting, our kids are still being educated, making sure that we can still continue as much of our normal lives as possible, even remotely. And you know, today's Easter, so we have a blessing. We have a blessing that back in the Spanish flu, when they had to take a lot of the same steps they didn't have, back in the Spanish flu, they basically had to board themselves up at home without the ability to communicate with anybody else out there in the world. Listen, we're dealing with something at a time that we are better prepared, that we have more knowledge, more science. We know that it's not going to be years, it's going to be months, and we got the ability to not just talk to, but basically see, if you have that technology, more people than ever before. None of us want to have lived through a worldwide pandemic, but our resources right now give us the ability to do it much easier than many people in the past. And this is just, again, we've talked about different chalk art that's out there, and art, our kids expressing themselves on this Easter weekend in a safe way. This chalk art, again, has been incredible. We're seeing it in Kentucky, and they're seeing it elsewhere, but I think our chalk art in Kentucky is better than anywhere else. All right, we haven't shown a picture like this before. This is an individual who has been released as a patient in a COVID unit, recovered, going home. Look at his family around him. You know, the toughest part of my job is to talk about the people who didn't make it. Maybe this is the best. If anybody else has recovered and wants to send in pictures, especially with your family or any other messages, they are special messages. I can't imagine how this feels, but it is, you know, the type of moment that reminds us of why we do what we do. All right, we've asked, and we'll have to ask again today, for every day that we lose people here in the Commonwealth, that we light our homes, facilities, and others up green. You know, this is Rupp Arena and Commonwealth Stadium. And we just appreciate we're seeing this everywhere else, all over Kentucky, even when it's in an empty building. It means something. Even if you live 4 miles from your neighbor, it means something. It helps people know that they are not alone, and at a time when someone has been lost, that their family can't even get together for a funeral. This is just one way we can show that spirit of compassion and renewal. And then I think we got one short video of people enjoying Easter in that virtual way.
It's coming.
One, two, three.
Again, keep it up. Let's keep modeling the positive types of things we want to see. Every time we engage in creativity like that, hopefully it inspires others. And now it's to the part where we keep our emotional and intellectual strength up, and we learn a little something new during this. We learn a little bit of sign language. So, you know, one of the first things we learned is that we will get through this together. And today, I think we're going to learn a little bit more. So Virginia and I are going to switch places once again.
Thank you, Governor.
Thank you.
Okay, so today's Easter, so we're going to say happy, and it comes from a place of joy. Happy Easter. And it just makes your thumb in, and you just shake it side to side. Happy Easter.
One more time.
Happy Easter.
All right. Thank you. We are in what we have talked about being, I think, the critical weeks here in Kentucky. Knowing that our efforts today impact us 2 weeks from now, knowing that we are in a surge or an increase in cases, knowing that we are flattening that curve, but there is more work to be done. That when we let up, that is when more people are harmed. And just to give you an idea, right now there are now over 500,000 confirmed cases. Those are through tests in the United States, 532,339. And there are places being hit much harder than us that show you how serious this is. New Jersey had 3,733 new cases yesterday alone. And in this country, we've now lost over 21,000 people. And for anybody out there, and they're probably not talking to you, they're probably talking on social media, that thinks we shouldn't be doing this, that thinks that this thing isn't a big deal, I just want to mention New York. New York, when 9/11 hit, and we all saw that we needed to change the way we did things, we were willing and united to do what it took to make sure it didn't happen again and address it. New York lost 2,753 people that day, including a friend of mine from college who died, I believe, when the first plane hit one of the trade centers. New York's already lost 9,385 people to the coronavirus, and we don't think we have peaked or that they are just close to it now and that there will be more loss to come. Understand that this is the challenge of our times. But we, like then, will rise up, we will come together, and we will do what it takes to defeat it. Remember, we've got to stick with it. I'm not going to show you the graphs today unless they come up with questions. I'm trying to go a little shorter today, and we'll see if that works. But what we are doing is important. We can call it a test of our faith, of being willing to do the things in different ways, following what our faiths teach us to protect our fellow human being. In my faith, Jesus was asked he was asked the most important commandment, and he gave two, and he said, love thy God with all your heart, and two, love thy neighbor as thyself. And that's what we're doing, our test of humanity. Are we willing to make personal sacrifices that sacrifice the things that we want to do, and even our economic security, and even agree to a time of major anxiety to make sure that we protect other people, some of which we don't even know. That's our test of humanity, but it's Easter, and I know that we are going to pass it. So it is Easter, and I wanted to make sure today we gave you some really good news. So as you know, we had done a trial test of drive-through testing. And at different times it had been paused, but I'm excited today to announce a new partnership with Kroger's. Kroger is teaming with the Commonwealth in an effort to test up to 20,000 people statewide over the next 5 weeks. And if you think about it, I'm going to read it later, I think we've only tested about 24,000 people total. So this will almost double our number. And then, of course, we have the other 2,000 tests a day that we're ramping up for in our separate effort. Kroger is going to provide the medical staff, the PPE, and the sign-up portal to make sure that people can come and can get what they need. The state is contracting with UPS and Gravity. Gravity Diagnostics is stepping up again for our state with additional support in testing that will provide a 48-hour turnaround for people getting their results. And this was important to me because 10 days doesn't ultimately help. I want to talk a little bit about who the testing will be opened up to first, and then I want to introduce Kroger that's here for us today. So even with this new testing, and we're going to start with one location tomorrow, and that's in Frankfort, and our hope is to announce one more location this week and 2 more next week. But what's really important is there is still a resource scarcity, and we need to make sure those who need to be tested the most get it. So we say Tier 1 up here. CDC calls it Priority 1, however you want to view it. These are who the drive-through testing, starting tomorrow, is going to be open to. Healthcare workers, first responders, individuals 65 and older, or those that have a chronic health condition. It's going to be really important that as we ramp this up, that we make sure that those who need the testing the most get it. And so I'm joined today. First up, we'll hear from Colleen Lindholz, who is the president of Kroger Health, and then we'll hear from Dustin Nimmo, who is the senior product manager of e-commerce, and they are going to walk us through, first of all, this great partnership. It's good news on Easter, and then also play a short video about how their portal for sign up is going to work. Colleen, we're excited to have you today.
So happy Easter to everyone, and I want to thank Governor Beshear, Dr. Stacks, and Director Dossett for the opportunity for the Kroger Company to partner with the great state of Kentucky, the Commonwealth, to provide COVID testing across the entire state. Also want to thank the partnership with the health departments around the state and the National Guard. It's been absolutely wonderful. Kroger Health's vision is to help people live healthier lives. And it's never been so and more important than right now for us as we help to expand testing across this entire state. An innovative part of Kroger's testing solution has to do with a digital registration process. And I have a colleague here that'll come up in a few minutes and demo that process. We believe this process is the first in the state of Kentucky and maybe across the nation, provides a very easy way for people to register for the test. So starting tomorrow, as Governor Beshear said, we will be testing here in Frankfort, Kentucky, open up our location. We are committed to running Monday through Thursday. We'll be testing from 10 a.m. to 4 p.m., 250 people each day. And as Governor Beshear showed too, we're following the CDC's Priority 1 and Priority 2 guidance. Our testing the tests that we actually use are the self-administered swabs, patient-administered swabs, and we are doing this because, for one, it's less invasive for the patient. Two, it conserves protective equipment, personal protective equipment, which is great. And three, it allows us to test more people in the same day. We will be announcing with the governor additional locations across the entire state of Kentucky later this week and into next week. But I want to say that in everything that we do at Kroger, it's all grounded and guided by our values and our purpose and promise, which is to feed the human spirit. Each decision that we're making during this COVID crisis, we're considering the safety of our associates and balancing that with the commitment that we've made to our communities. So right now, I'd like to bring up Dustin Nimmo to show you a demo of the registration process. Dustin?
Thank you, Colleen, and thank you, Governor. Grateful to be here and share with you the experience that many teams have been working on for several weeks to make testing accessible to everyone and being easy to find anywhere on the web. So we want to talk through just quickly, if you go to krogerhealth.com/COVID testing, this is the experience that you'll look at, and we'll look through this video. So you'll find just a simple landing page that tells you everything you need to know. We've worked with Microsoft to build this health bot that will help kind of get people through the right path of care so that we're getting the priority 1 and priority 2 people into this portal. You'll be able to find quickly a location wherever you are in Kentucky, and you'll be able to schedule an appointment very easy. And from this point on, we'll ask you just to put in some simple information, where all this information will be funneling into our electronic medical record keeping system, and that way we'll be able to track your information as well as your testing information to get you that feedback upon those results coming in. And while this is going on, just take a moment to realize that there are people, many people who actually are residents of the Commonwealth of Kentucky who worked countless hours to build this web portal as well, and as we're based out of the Cincinnati area, so it's honor, and we take it very seriously to get to serve and care for our community in this way. And so as you go through this, you fill out all of your information, and you'll simply be met with several times to choose from, to pick a location, to pick your date and your time to show up, and then just met with, we've got your information, success, and then that'll be followed up by an email that will come directly into your inbox almost immediately. That'll look like this. It'll give you all the information that you need about your testing site, about the timing, as well as all the information of what to expect when you show up to a testing site. We want to make it as easy as possible. It's not anything that's scary, but something that's very simple and easy in a way that we, as Kroger and just as human beings that we all are, that we get to care for one another in different ways during this time. Thank you.
Well, I'm very excited about this. It's good news on a day that declares the good news. And we have been working on this with Kroger for several weeks or even more, just trying to get it right. And we are excited about this. We think it's going to be a great benefit to the Commonwealth. We're going to make sure we get through tomorrow and work the kinks out, and then look forward to announcing at least one other location this week, and then moving it out in other places in the state after that. Again, the possibility, the potential here, just from this program, could almost double the amount of testing we have right now. And as we, as a country and as a Commonwealth, look towards eventually after we peak and as we start coming down, what's it going to take to ease restrictions, increasing our capacity for testing. The methods of testing is one of the most important things that we're going to have to reach to get to a point where we can do that. So very excited about this today, and in fact, the reason that this is our only major update today is because we're so excited about it. All right, our numbers today, it's less than yesterday, and that may be because of labs reporting, but it may also be that yesterday we just had a significant number of cases. That we are announcing 134 new cases of COVID-19 in Kentucky. And again, when we go through each day and remove people we now know live in a different state or were reported in different ways, our total number of cases in Kentucky, our official number is 1,963. So we're getting very close to that 2,000 mark. But here in Kentucky, we are still not seeing the type of increases that we are seeing in other states, and we are very grateful for that. But still, we are in that phase where the coronavirus is increasing day by day, spreading across the Commonwealth, and we got to do everything we can to stop it. We know that we are flattening the curve. Let's not let up now. I mean, you look at in places where they let up a little too soon and you're seeing troubling spikes. Let's win the very first time that we face this virus. So the new cases by county today, 35 in Adair. And this is about a nursing home there that we are working with that has been hit particularly hard. I hope our thoughts and our prayers today are going in a lot of directions, but ought to go there as well. 30 new in Jefferson, 15 in Fayette, 16 in Christian and Muhlenberg, 5 in Davis, 4 in Jackson, 3 in Boone, Hopkins, and Scott, 2 in Owsley, and 1 in Ballard, Bath, Callaway, Clark, Fleming, Graves, Grayson, Hardin, Harrison, Jessamine, Kenton, Madison, Ohio, Pulaski, Rockcastle, Shelby, Todd, Warren, and Whitley. And then we have a couple that are still unconfirmed. And today we also have 3 additional deaths to report. On Easter, I'd hoped, maybe beyond hope with what the coronavirus is, that we wouldn't have to report new ones today. But we have a 72-year-old male from Jefferson, a 74-year-old female from Hopkins, and a 62-year-old male that we believe is a Pike County resident, or at least was being cared for in Pike. Let's slide our houses up green. Let's slide our places of business and our facilities up green tonight and every night. Today is not only a day every year for compassion, but of renewal. And it reaffirms our faith that for these 3 individuals and now the 97 that we have lost, that our bodies are merely vessels, and that we are taught that our spirit is going to a better place. And so let's keep these folks in our prayers. Let's remember that every action that we take and every action that we don't take, every time we stay healthy at home, makes it less likely that any day in the future somebody is going to lose somebody that we have to read off on these nights. Number of people tested in Kentucky to date, we can confirm 25,866. As we see an increase of testing every day, we want to increase this even more. Number of people ever hospitalized, about 667. Number of people currently hospitalized, at least 289. Number of people in the ICU ever, 256. Number of people currently in the ICU, at least 136. Let's be thinking about those 136 today as well. And the number of people recovered, at least 607. That's the number, and that comes out of the overall positive tests. Those are included in that. And let's be thankful for that. And when you think about how long we've been going at this virus and how long it takes for people to recover, that's a good number. We're excited about it. And today we got to see a picture just through social media. I've never talked to that family, but I was really excited that they had posted that, and that we could talk about it. Our breakdown on race, I have the total number of cases today. I think we need to pull the death breakdown. But on total number of cases, we know 70%. The racial breakdown. So for 70% of all the positives, we know the racial breakdown, and it's 81.75% white, 11.64% Black or African American, 2.51% Asian, and 3.99% multiracial. And if you'll let me, I'm going to look through my papers just to see if I have the other breakdown very quickly. I do not. We will provide that tomorrow, or can provide it via questions a little bit later. Updates of a couple of places that we are directly following, and we'll add to this in the coming days. Western State Hospital today has remained the same. We believe, though, that there's going to be one positive case at least that we will report tomorrow that we think is coming in this evening. We're working with them directly. This shows how quickly, it's not just senior centers, but in facilities like this, that it can spread. And just look, I mean, we have 13 patients, we have 16 staff members. These are people who are still, helping those that they might get the coronavirus from, and we appreciate all of their work. Green River Correctional Complex, our cases have increased by 1. We have 1 new inmate that has tested positive. The staff is currently at the same level. And then in our long-term care facilities, and this is one of the reasons that it is so important we stay healthy at home, because we never know when our contact to someone else and their contacts to someone else and theirs gets in a long-term care facility. And we ought to know that every mass gathering we do is going to create at least a positive test in one of these facilities that can blow up and balloon into so much damage. This is how this thing spreads. We have 19 more residents in our long-term care facilities just from yesterday that have tested positive. We have 11 more staff, and ultimately we have, though they were recorded yesterday, and we're just now knowing exactly what facility they're from, 4 more deaths. Again, this virus comes for the most vulnerable, and protecting them are the steps that we take every single day to do our very best to reduce our contacts. So let's make sure that we keep that up. Let's make sure that we do our part to not spread this virus. And let's make sure that we don't create the opportunity or even the invitation, especially from people from out of state and in places where this virus is much worse, to come to mass gatherings where they can take all the contacts from their state, which isn't doing as well, and spread it all throughout ours. Let's make sure we are selfless and not selfish, that we sacrifice for others and not require that others sacrifice for us. Our test of humanity was never going to be easy, right? Tests never are easy. And today we think about that. And it's gonna take us having to do things we don't like, or not going to things that we do like. but we're strong enough, and we know the ramifications of what's on the line. So let's make sure we continue to do the right things to pass this test of humanity, and that when we can all get back together again, wherever it is, as many of us are there to celebrate it as possible. Do you have Crystal, the breakdown? Let me. That last piece of data, and this is, I mean, it's really concerning data, is that when we look at the breakdown of deaths, we have 81.55% of the racial data for our deaths, and out of that group, 77.21% is white, 21.51% is black or African American, 1.26% is Asian. It's not okay, and it's not right, and it shows that there are problems in our Commonwealth that while they have existed for some time, they shouldn't exist anymore. And while I believe that expansion of Medicaid in Kentucky has helped, there's a lot more that we should have done before now, and unfortunately people in our society are paying for it. I hope when we come out of this, we can correct a lot of things that we talk about a lot but don't necessarily have the will to do. So for that, we will open it up for questions. I thought we'd go 30 minutes tonight. I'm at 40. We'll do 10 to 15 minutes. We've got Shelby Smithson. We've got Philip Bailey, and we have Karen Czar here tonight. And I have just a few questions that have come in. I made Phil go last time, so we'll let him go first this time.
Governor, today at the Maryville Baptist Church, roughly 50 worshipers attended and ignored your order against mass gatherings. Many of them who spoke with the Courier-Journal said they have no intention of abiding by your quarantine order of 14 days. What do you plan to do?
So the question is on a specific church, Maryville Baptist, that has been doing in-person gatherings now for multiple days during this. Today, they had a very public one, and from a video I watched, they had two people who drove in from New Jersey and then sat in that mass gathering with everybody else. It's a state that had over 3,000 cases that may be the new epicenter, and because of this open invitation, even on a special day like today, just brought all of New Jersey's contacts into Kentucky. Now, if you're somebody living in Bullock County or just right over the line in Jefferson, how do you feel about that? You've been making sacrifices. You worship virtually today. But tomorrow, if you're still going to work, your place of work could have somebody that was exposed because of this. At the grocery store where everybody's trying to do their best, there could be somebody who's been exposed because of it. And with somebody coming in from out of state, especially that state, it could be thousands upon thousands of more contacts that we have just been exposed to. Now I want the story of the day to be the fact that I know we have way more than 5,000 churches in Kentucky. I know we have way more. And we believe there were about 7 that did an in-person service today. So, to all of those houses of worship that have all different, I don't want to call them ideologies, but approaches, and thank you. Oh my goodness, thank you. I know this is hard. This hadn't been asked since about 1918. But thank you. And I think you lived your faith today. I think you proved that you're willing to sacrifice and make the tough decisions, just like in our religion, since this is Sunday, our Savior teaches us. And I want to thank you for your kind words as we've gone through this. Because of your work, so many people are safer today than they otherwise would have been. And I believe when we look back and we look at the data about how many people watched live streams or went to drive-in services, because this church could have done a drive-in service. That's perfectly legal. You could have done it and didn't. But when we look back, I bet we've had more people watching and participating virtually in our services than ever before. But I wanted to invite Dr. Stack up to talk about this too. You know, I talk about it in a lot of different ways, and admittedly, I'm pretty emotional about it. But I wanted you to hear the scientific basis for what can happen in any mass gathering, any one.
Thank you, Governor, and happy Easter to everyone. I hope you found time to, even socially distanced, to have time with your family. So, last Thursday I got a little emotional for the first time in one of these briefings, and I'm not sure it was clear the reason I got emotional, and I know the Governor's turned to me here to describe the science, but I'm going to try to make the science accessible without having to understand science. So in Hopkins County, there was a revival a few weeks ago, and we know that over 50 people were sick, directly related to that. We believe from an epidemiological, scientific standpoint, over 50 people were sick and there are 6 people dead. So I guess breaking it down just as bluntly as I can, does our right to gather together entitle us to have other people die as a result? I mean, that's essentially what's happened. Now, this is not just about church. This is about any gathering. I don't care if it's a bass fishing tournament at a state park. I don't care if it's a church gathering. I don't care if it's any other kind of gathering. We are at a time and a place in history where the human species has never faced, for the last 100 years, a threat like we face right now. So, I'm Catholic. I've been Catholic my whole life. I went to college all the way through college at a Catholic institution. Last night, I've told you all, I studied Latin for 8 years and Greek for 6 years. I took out my Greek, English, New Testament and read the Gospel of John last night after I had spent hours trying to resolve yet another nursing home crisis in another county. So I am very grateful that the Governor can stand here and report good numbers. That is a testament to the vast majority of Kentuckians who have come together, who have risen to the challenge to place their love for their neighbor above the self-sacrifice they've had to make. And I am so proud of all the examples that we can stand here and tell of Team Kentucky coming together. But for those who continue to flaunt the things we are asking you to do, it raises for me the question, at what point does our right to gather entitle us to have other people die as a direct result? And I spent no less than 5 to 6 hours already today, frequently with groups of people as big as 15 or 20 at a time, trying to help communities who are in crisis because we now have elderly confined populations starting to get hit by this. And so when I got emotional last Thursday, I did not get emotional because of the fatigue or because I was inspired by the student volunteers who do inspire me very greatly, or because people are dying, which is a great tragedy, but something as an emergency physician I have experienced all too often up close. I got emotional because I have been exposed to the severe anguish and distress of healers and leaders in their communities at the point of breaking and beyond, because they are up close and personal to this and seeing things the public has not seen. So I support very much a positive message on Easter Sunday. I want you to celebrate the good things you've done. But I am standing here today not to talk to you about statistics and figures and data, which I'm happy to do at any future time. I am here to make this as real as I can. The choices and decisions you make have direct implications not only for yourself, but for others. So I ask you to reflect today, as I did with each of these calls I did, one after another, that though I was not in church today on Easter Sunday, I would tell you, I cannot remember a time where I did more to show our love, myself and the people that I worked with. I never had a day in my life where we did more to show our love for our fellow men and women than today on Easter Sunday. And I would ask you to consider that yourselves as we go forward. So, happy Easter. I'm sorry to be so stern today, but I think people have got to understand this is not a game. And even though the numbers look good now, they only look good because of the steps we took, and it can all be undone. And unfortunately, in Bullitt County today, that one instance, because we took people from a hot spot in the country, that entire county now runs the risk of going bright with all sorts of new positive cases and deaths as a result. So I'd ask you to reflect on that before you get together in gatherings when we're telling you to please don't do that. Thank you, Governor.
Thank you. And ultimately, we expect that those who make a decision to attend a mass gathering of any time voluntarily self-quarantine. It's the only way that their decision doesn't potentially kill somebody they don't even know that didn't make that decision. So everybody out there, if you're my age, think of your parents. Mine are in their 70s, and that I'm guessing all of your parents watched virtually or worshiped in a different way. Maybe they went to a drive-in. They did the right thing. So those that don't do the right thing, they'll probably be asymptomatic. They might not ever know they have it, but they spread it to someone else who spreads it to somebody else who spreads it to your parents or grandparents out there, and it kills them. They didn't make that decision. And so, it's just important that those who do make a decision to go to a mass gathering don't spread it and someone else suffers the repercussions. We'll come back around. Shelby.
So kind of along the same lines, can you comment on Kentucky State Police's efforts today as far as volume of putting those notices on people's car, taking down license plate, the manpower that takes, and also moving forward, what kind of manpower as far as enforcement of those quarantines and that kind of thing?
The question is on manpower for today, on just making sure that we could identify folks that will need to ask to self-quarantine. To make sure that somebody self-quarantines and their decision doesn't spread, we just need to know who they are, to send them the letter to ask them to do the right thing. They're not being charged with anything at this time. We just have to have an address. If we're going to send a letter and they don't spread it to their neighbors and their coworkers. It was a very small group of folks that went to mass gatherings today. We had an amazing outpouring of support in Kentucky for doing things different if it meant protecting people. And going forward, I'm not sure that we'll have to take this enforcement step again because we're down to such a small group, and I hope that they'll see the need. And maybe other pastors will reach out. And please, everybody, know that we tried everything leading up to this point. We begged and pleaded with people. We did a notice of violation, and this only pertained to a couple places that said no matter what, we're doing this, and we don't care what happens to other people when we do it. And so we had to take a couple steps. My hope is that we won't have to do it anymore going into the future. And remember, there are still so many different ways to worship where you don't spread the coronavirus. Any of these groups can set up a drive-in worship service. And so why wouldn't you? If it means the virus won't spread and you can still be there and celebrate God. So, Karen.
You've already answered my question, so thank you and happy Easter.
Happy Easter to you. Okay, so I've got one that says how many churches violated the order. I don't have that in front of me, but I know there were less than 7 that we knew of that were still planning on having services. What I hope beyond hope doesn't happen is that we don't just start seeing the results of some of these decisions in really painful ways to the congregation itself, like we see all over America. We see. I talked yesterday about a choir in Washington State that did just got together to practice, and there are now multiple deaths, and I think it's something like 20% of the entire choir have come down with the virus. I hope inside our congregations we don't want that. Phil.
Governor, just to press you on that point, though, these folks were pretty adamant about not abiding by the rules. Do you support ankle monitors for church attendees like we've done in some cases in Louisville as judges have ordered where folks refuse to quarantine? If these folks ignore your letter, they ignored the order and you're pleading today, and they ignore your letter, would you support an ankle monitor on these folks to keep them in line?
The question is, would I support ankle monitors by folks who went to a gathering today who don't want to voluntarily comply with the self-quarantine? It's not going to come to that. These are folks that made a decision to go to a mass gathering. We can prove scientifically that mass gatherings spread this. I believe that the community, which is what is truly at stake, the community in Bullitt County is going to respond in a positive way that suggests that all of these folks need to just stay home for 14 days so the rest of this county and other counties don't become the type of hotspot. No, I don't think we're going to have any type of ankle monitors. No, we don't need any of that. We just need people to do the right thing. Today is about doing the right thing, and none of this is about attacking any faith. My goodness, my son was supposed to be baptized today, and he couldn't because we can't meet in an in-person service. And while he was sad about it today, he was sad about it. He knows that it's protecting other people. And when 5,000 plus churches of all different denominations, every single one of our temples and synagogues, and every single one of our mosques, all of them know what the right thing to do here is. No, this is a bigger coming together of all forms of religion, unifying to protect our people here in Kentucky. I can't think back on a time where more, whether it's denominations or more different faiths, came together, agreeing to do the right thing at a time to protect our people. We talk about being more united than we ever are, and I've kind of thought of that about different divisions, but I think it's also amongst our faith community. So there was another question here today, specifically about folks from New Jersey coming down. Remember, those that want to have mass gatherings, send out a signal all around the country to those that don't think this virus is serious, that don't follow the rules, and that want to come to a place to make their point. So every time one of these happens, remember, people from places that aren't social distancing, which means they are intentionally exposing themselves to the virus, are likely to come to Kentucky and spread it to us. So Team Kentucky is about all of us coming together and doing the right things. Shelby.
So as far as pricing for the new drive-through testing, we've heard from viewers that the test is somewhat expensive for people who don't have insurance. And with so many Kentuckians recently out of work with no insurance, is there any help for payment for the test or something like that?
Yes, that's what our drive-through testing with Kroger is going to be free of charge. With my commitment to everybody is free. Now, when you go to a testing site that is charging, especially charging cash, I'd ask a whole lot of questions. Doesn't mean it's not a real test, but who are they testing? Why is it being charged? Because everybody up the line in government has said they want this to be free. And how long is it going to take you to get, if you get it at all? Let me say this: Kroger is not charging the state 1 penny for this. I don't know anywhere else in the country that people are doing that. They might be, but that's really incredible that they are providing the people and the PPE to do it. They did this portal on their own dime. Now, we as a state are paying for the kits and the shipping, but we really, really appreciate that. It's going to help us scale up. What sort of pet stores are currently allowed? Certainly any emergency veterinary services, any absolutely necessary veterinary services, stores that are selling pet food, but folks, just about everything else we shouldn't have. We shouldn't have obedience training right now. You know what? We're home a lot. Watch the videos. You can become a trainer yourself one day. No doggy daycares. Can't do it. You'll have to do what I do, find a spot in your house where you'll be able to pin the animal up, and then it can just eat all your stuff like mine does. No boarding of your pets. You shouldn't be traveling anywhere. So there's no boarding and no grooming right now. Yes, that's going to mean my remaining dog, Winnie, looks like a Wookiee by the time that she is done, but I think she likes that look anyways. Phil? More?
Governor, are you worried at all that your attempts to hold down the spread of the coronavirus are being turned into a political issue that will undermine your efforts? And should you have handled anything differently?
The ask is whether my efforts to stop the coronavirus could turn into a political issue, and would I handle anything differently? I'm way beyond politics at this point. And what happens to me in the future because of decisions I make, at this point, I don't care. My job is to save as many lives as I possibly can. I had to take a tough stand on Friday, and yes, I'm sure it'll be used in political ads, but if it was, which we calculated, 42 lives, if what happened in Hopkins County, and we haven't seen the full ramifications of Hopkins County yet, happened everywhere else that we're doing a mass gathering, I'd trade a re-election for 42 lives any day of the week, any hour of the day. We are in trying times. But today is a day where I look at my faith and realize that my Savior had to make difficult decisions in trying times when a lot of the establishment didn't like what he was doing. Attempts to save and to help our fellow man. I believe taking a tough line, which we had to, saved lives today. Not just lives from people who might have gone to a mass gathering, but where it was spread to and where it was spread to and where it was spread to. It hurt. It still hurts. And it hurts seeing the reaction, but my job isn't to worry about my feelings or the reaction to it. My job is to protect the people of this Commonwealth, popular or unpopular. And a lot of people want to look at what governors are doing and saying, oh, does it make them popular or not with their people? I don't think any of us, Lord, I hope no governor is making decisions that way. Getting through this is going to be tough. Coming out of it, everybody's going to second guess your decisions, and that's fine. As long as I've done the best I can with the best information that I have, that I've followed the science, that I've made sure that we do in the very least what we did in 1918. And folks, in 1918, at least in Louisville, they had to close all houses of worship. We've done this before. This isn't new. And we're seeing some of these challenges all over the country. But what I love today is on Easter, during Passover, that the people of Kentucky, by and large, to a greater degree and a greater percentage than in anything that I've seen in my lifetime, we came together. We came together not just to worship, but to protect each other. We came together unified to say that we care more about each other than any political point or any desire to get together. We came together today in a way that makes me proud to be your governor. And looking back, if I have to look back and say the decisions I made to save our lives, to get through this, impacted in some way my popularity negatively, fine, absolutely fine. I've run out of other words. Anybody else?
One more final question for me, Governor. We at the Courier Journal keep hearing about people being told that other businesses such as grocery stores, big box retailers have full parking lots where social distancing isn't being followed. Why aren't they being punished?
The question is grocery stores or big box retailers where they might have full parking lots. The question is, why aren't they being punished? First, let me say that we have taken extraordinary steps with these facilities. They are facilities that are necessary if you're going to be healthy at home. Certainly look at a grocery store. You look at the steps that Kroger has taken recently, limiting number of people in the store, creating one-way lanes, requiring people stop 6 feet while others are doing shopping. Now, we're all learning about this at the same time, and every weekend, and that's when we kind of see the surge, has gotten better than the others. But we are actively out there monitoring, working with, going to, and inspecting through the labor cabinet and through the local health departments. So, folks, we are out there talking to managers and looking at different things we can do. And if we have to, when folks aren't following it, we are shutting things down. I think there have been at least 18 different businesses since the calls have come in, because it's any mass gathering or any group that's not doing their best to follow the CDC guidelines. So let's wrap up, because I've now gone an hour when I said I'd go 30 minutes. My apologies for that. It's a special day. In my faith we say he is risen. But to everybody out there, regardless of your faith, thank you for sticking with us. Thank you for working so hard. You are flattening the curve, which means you're saving lives. 10, 15 years from now, I hope people are saying that we are a great generation. That when asked if we would sacrifice, if we would do things differently, if we would make really hard decisions, even the ones that are unpopular, and if we would come together, and even when we question decisions, not attack each other, but just try to support one another. If we would show more kindness and compassion, then I think we will be remembered as a generation that had a different test than anyone else. And at a time when people questioned, I think, our humanity, on our divisions and the way we speak to each other, whether that's on social media or anywhere else, that we prove that the people of Kentucky and of the United States and in this world are still really good people. Maybe we needed a reminder of everything that unites us. Maybe we needed something that made us slow down and appreciate each other. Maybe we needed to be forced to be apart to know how much we want to be together. Maybe we'll never have that moment where we refuse to shake each other's hand again because we haven't been allowed to shake each other's hand in over a month. On this day, when we think about the miracle that it is to live and to get the opportunity to be around one another and to share so many different experiences, I hope we recommit to doing everything it takes so that it's Easter now. We have as many people there at Christmas or through our other spiritual and faith holidays as possible. Now I'm going to take a point of personal privilege to end tonight. We do a lot of videos as we end, but tonight I'm going to show you my kids. They put together this song, which we put on social media earlier today. They would have been singing this in church right before Will would have been baptized. So let me leave you with Will and Lila, My Reasons for Living. I'll see you again at 5. Thank y'all.
Round the clock on either side of the grave.
Low in the grave he lay, Friday, Saturday, Sunday. As the sun rose that third day, the women came, and what they encountered at the tomb marked the end of death and doom. For not an angel but two stood there to say, He's not here. Jesus is risen, so do not fear. He's alive. He was crucified, but escaped the grave. He's not inside. No, he's not here. He is alive. Up from the grave he rose, leaving his grave clothes. When the women ran back home to tell the joyful news, most who heard did not believe. John and Peter ran to see if what the women said was really true. He's not here. Jesus is risen, so do not fear. He's alive. He was crucified, but escaped the grave. He's not inside. No, he's not here. He is alive. Hallelujah, hallelujah, hallelujah. He came from heaven to earth to show the way, from the earth to the cross, our debts to pay, from the cross to the grave, from the grave to the sky. Lord, I lift your name on high. He came from heaven to earth to show the way, from the earth to the cross, our debts to pay, from the cross to the grave, from the grave to the sky. Lord, I lift your name on high. He's not here. Jesus is risen, so do not fear. He's alive.